I think that there's hope out there. I don't see mental health issues. I don't think depression, anxiety, PTSD are physical genetic issues. They've never found a gene for these things. So anyone who's suffering deeply with these things, to know that there is a way you can actually live a fulfilled and meaningful life. Don't give up. These things are coming, and they're going to be more accessible, hopefully, more accessible to more people, and cost less, hopefully, over time. The insurance will eventually start to cover it, or government programs will cover it. So there is hope out there. And to really, if this is something that you're called to find places that you align with, and to look into this work, read up about it, know what you're getting yourself into, of course, but to know that you're not sick, and don't give up hope. That you're not here in this world. We're not here to suffer or to be punished. I don't care what you did or what you were exposed to. There's hope, and that's what I like to leave people with.
Hi, everyone. Welcome to Psychedelic Conversations. Today we have Stephen Radowitz from US. Welcome to our conversation. Thank you for making time.
Thank you for having me.
And for our listeners, just to give a bit of context of your background, I'd like to say a few words from your bio and what you do, and then we can take it from there.
Great.
Dr. Stephen Radowitz, he has a wealth of experience seeing the effects of trauma can have on our physical health firsthand. He joined Nushama to oversee and develop treatment modalities, believing psychedelics are the future for mental wellness, as current solutions treat symptoms, not underlying issues. And you also run the primary care program at Goldman Sachs and practiced internal medicine and primary care since 1998. You also led the alcohol and opioid detoxing treatment unit. So that's really interesting for us to hear from that as well. So we'll add all the full bio and your links where our listeners can find you and learn more about what you offer in the show notes. But for now, without further ado, what brings you to this medicine work?
Thank you for having me. I guess working in primary care over the many, many years, I started to see the limitations of traditional, medicine, this sort of separation of mental health and physical health. And through my years of experience, started to see how mental health really does have an influence, a significant influence on our bodies and how we live. That being said, I saw a lot of issues, and especially in the United States, and the American healthcare system has many issues, and very there's a lot of there's a lot of separation in care, and the way things are treated in a very mechanistic way and less holistic way. Also, I saw that people were not being treated properly. I saw in mental health, a lot of my members, I was, I'm a primary care doctor, a preventive medicine doctor, and I saw some of my patients who would go on mental health issues, go to a psychiatrist and come back, after a period of time on, laundry list of, up to 5 or 6 different medications, and sort of dead, sort of empty. They didn't feel sad, but they didn't feel happy. They felt nothing, and so I stopped prescribing. I stopped sending people to psychiatrists and got more comfortable. If need be, I'd send people to take care of some of their psychiatric needs. I would prescribe certain medications if need be, but also talk to them about, meditation, mindfulness, spirituality, and other things, other more holistic approach. And then, and hopefully with time, when things evened out, I would be able to get them off of any medications that were prescribed. I started as far as how I got into the psychedelics, through my own journey, I guess, spiritual journey. I started studying, spirituality through what's called Kabbalah. It's more of a Jewish mystical tradition. About 18 years ago, a non-Jewish patient gave me this book on it, and I'm like, oh, this was very interesting. I started reading it. It was almost a science to me, and it also allowed me to see a different layer, a different way of viewpoint of healthcare. And then right before the pandemic, I'm a physician. My husband's a physician. He was having very terrible headaches, like daily headaches. And after we have 2 children, after our first child was born, and he tried everything: acupuncture, Botox, medications, sinus surgery, everything. Nothing took it away. And then someone mentioned doing, some plant medicine, some journey medicine. And in the first journey we went to, he was shown where the headaches were coming from in a very, very specific way. And the headaches completely disappeared after the first journey. And so we started getting in. I started to see this is not just like a mental health issue. It was, it actually had an effect on his physical health. And we did a number, and I got, had developed a number of, through a number of experiences, I saw the power in this form of medicine. And over when COVID hit, I was practicing medicine, and I saw, people were having a lot of significant issues with mental health, with depression, anxiety. And one of the people, a friend of mine, came to me and said, hey, we're thinking of opening up a ketamine, a psychedelic wellness center. We need a doctor. And I'm like, it just felt right. And I stayed in my current, my previous practice, started working here part-time. And then working through this, it got really busy. And I saw how effective it was, actually more effective than I expected it to be. And I went full-time in this. And it's been an amazing, amazing journey. And I'm learning every day. So humbling.
Yeah, that's so wonderful. Thank you so much for sharing your journey into it. So you are a ketamine doctor, is that correct? Would you say?
Yeah.
Why ketamine? Is it because it's legal? Because it is legal now, right?
It's legal. So yeah, when used in a clinical setting, with a licensed professional, yes, it is legal to use. I think in the UK as well as in the United States, in a specific clinical setting. I like to say I am still primary care provider. I'm an internist, internal medicine, and I really believe in primary care and preventive medicine. So I still, even using ketamine, I think this is really getting to the source of treating illness. So I still believe in it. I'm still practicing medicine, but in at a more early stage, the seed level of rare disease. So people hopefully don't have to go through, some of these physical ailments, mental health or physical ailments. So yeah, just to clarify.
Yeah, thank you so much. Yes, I love the idea or the concept of the preventative, wherever we can to help them. So what are you seeing as a doctor? We've gone through such biblical event like pandemic. What are your observations? Is that why psychedelics are coming back really strong? Because a lot of people believe so.
Yeah, I mean, I think that's a big part. I think it started off, there's an openness to this type of medicine. And, we're starting to see cannabis and marijuana, which is not a psychedelic in any way. But it definitely is opened people up to, the legalization of that in the United States and many other countries now has opened it up. There's definitely an openness to using other substances, psychoactive substances, for medicinal purposes. So that really was one, impetus. And then the I guess a rash of mental health issues, suicidality, increase in suicidality, addiction issues. Our current treatment modalities are just not working well overall. They work for a period of time, but they're not getting to the seed level of the issue. So I think we just need something. And this has always been shown. This is not a new treatment. I mean, it was available in the 60s. LSD and psilocybin were extensively, and ketamine was extensively studied in the 60s and had amazing effects. But it was a very difficult time. There was this society was just going through its own revolution at the time. And the people in power at the time felt that it was a destabilizing force. And I think people started to misuse it before as a society, we're ready to use it on a mass scale. And if it was kept clinical, I think, and started to really be let out in a sequential way, maybe, we've been using it throughout this period, but unfortunately it wasn't. So this is not new. And I think we're going to start to see these other agents also incredible effectiveness in other psychedelic agents, not only ketamine. Yeah.
Thanks for sharing. I love your thought about we weren't ready. If we kept it as a clinical work or medicine for the clinical work, yeah, that would have been ideal, right? But then he quickly went out into the public's hands, you know. Do you also believe that we lost a lot of research time? Like, you know, people say we lost at least 5 decades of so much work we could have done.
100%, 100%. We lost many, many years of amazing, amazing work. And during that period of time, something else took its place with, I don't think, with significant consequences. We have a lot of people now, on medications that are quite soul numbing, that actually have a lot of side effects, even increased suicidality, like the SSRIs, a lot of the antidepressants that we're using now, they have their place, but they were never meant and they were never prescribed, they were never studied to be used long term. And there are consequences to that. I think we have overuse of a lot of other agents like benzodiazepines, which are highly addictive, and overused in psychiatric care. Opiates for pain, overused, so we've seen, I think it did have significant effects. And psychedelics in themselves are actually quite safe. They're not addictive. There's no psychedelic, when used properly, has ever been shown to be addictive in any way, as opposed to some of the medicines that we're actually prescribing, like benzodiazepines, opiates, and things like that, which are highly, highly addictive and dangerous. So, but I think that there's other reasons to, why these things, and there's a big business. You have to remember, psychiatry and drugs and drug development it's a business. It's a multi-trillion-dollar business. So they're not going to let go of that business so quickly. So there's going to be pushback, I believe, as these things come on board.
Yeah, that's great. So I think it was Dr. Jordan Peterson, I heard him saying 2 things can kill you if you try and stop immediately. One was alcohol, the other one was benzodiazepines. Is that true? Would you agree?
Very true. Benzos are far more even more dangerous than alcohol, the most dangerous. Benzodiazepine withdrawal is very difficult to get off. It can take years to really fully get off of them. And you can die if you stop them suddenly. It takes a pretty significant dose, but you'd have to be taking a lot of it every day. But if someone stops suddenly, they can have a significant it can be deadly. Same thing with alcohol. Yeah.
Do you know why? What is the reason for it to be so deadly? Do you understand it? Is there
it causes a massive, it suppresses the system. It causes a massive, it affects certain neurotransmitters in the brain, and it causes suppression of the nervous system. So when you take it off, when the brain isn't used to being, and it starts to rewire based on that that suppressed system, when you just take it away suddenly, the system becomes hyperactive. You can have almost like a adrenaline storm. So blood pressure goes through the roof, heart rate goes through the roof. It can cause arrhythmias. It can cause seizures. It can cause and death, stroke, and a complete cardiovascular collapse. So it's very dangerous, very significant. So no one should stop these agents suddenly without without being weaned off in a clinical setting.
Yeah, thanks for that. That's a really good call. And would it also cause psychotic breaks or anything psycho?
Absolutely. DT, delirium tremens. Yeah, you can have absolute psychosis, delusions, panic attacks. It's quite dramatic. Even coming off of certain antidepressants, especially like one venlafaxine, or we call it its brand name in the United States is Effexor. I don't know what it is in the UK. But it can be very, very difficult. And some of the SSRIs, the serotonin reuptake inhibitors, like fluoxetine, and they can be very difficult to get off. It can take months, if not a year, to get off some of these things properly, depending on the dose and how long they've been on it. So there's definitely consequences to taking these medications, especially on a long-term basis.
Yeah. So one last thing about this. What about alcohol? Why does it kill somebody if they stop immediately? What's happening in the body?
Same thing as benzodiazepines. The same idea is that the alcohol is a suppressive agent. It sort of suppresses the brain. And so when you take it off so quickly, the brain becomes the the nerves become hyperactive in a way. So you get also adrenaline load, blood pressure goes through the roof, heart rate goes through the roof, and it can cause arrhythmias, so death through arrhythmias and hypertensive crisis. So like a very, very high blood pressures, and it can cause stroke and bleeds in the brain, many different things. So coming off of alcohol, usually very high doses, could have significant and deadly consequences. Yeah. So it has to
Wow.
be off, and you can wean people off. We usually use benzodiazepines to wean people off of the alcohol, which is, the standard of care. But we don't keep people on the benzodiazepines long term. They take it for usually about a 3, 4, 5 day course of weaning people off gradually, and it's very effective.
And you've been in the thick of all of this. You worked at the center to detox the opiates as another whole similar
it's a whole
situation, right?
Yeah, the thing with opiates is that opiates like heroin and OxyContin and all these other drugs, it's a very uncomfortable withdrawing is not deadly for that. So they don't go into the same type of crisis, but it is incredibly uncomfortable and difficult to come off of it. So obviously those people too need to be weaned or sometimes put onto some maintenance medications to prevent them from relapsing.
I understand. So for our listeners who are maybe just tuning in for the first time and they heard about ketamine the first time, what would you like to share? What is ketamine and how is it administered?
Right. So ketamine is it was developed as an anesthetic agent in the 1960s. So we've been using it. It's not a new drug, and we've been using it for many years. It's unusually safe anesthetic in that it doesn't affect the respiratory drive, even in much higher doses than we would use for mental health issues. Even in anesthetic doses, it doesn't suppress the respiratory drive. It doesn't significantly affect the cardiac output, so the heart function or the ability to swallow your fluids. So like when you sleep, you don't have to think about, breathing, swallowing your saliva, or your heart functioning. You don't have to think about it while you're on the ketamine. So it's unusually safe. It's been used in pediatrics. It's safely because of these effects. Even if a child, should break a bone or something in an emergency room or in the back of an ambulance in the United States, they would give actually quite high doses, higher than we use per kilogram in an emergency setting because it's so safe. It has very few side effects, very few drug interactions, which is really nice. So the nice thing about ketamine is it doesn't, when we use it for mental health issues, people do not have to come off of their current psychotropic medications. Sometimes we have them hold. There are certain drugs that could limit the effects of or temper the effects on mood, like lamotrigine, which is a mood stabilizer. It's an anti-seizure medication that we use as a mood stabilizer for various mental health issues. So we'd have them hold that dose, which is not a problem. Benzodiazepines, we'd have people hold. But generally, there's no absolute contraindications to using ketamine with other medications. So which makes it a very safe and a very good option. It's also very short acting. So when we give it IV, we can stop it at any time. It comes out of the system very quickly. So if we stop the drip at any time, within minutes, people come back to themselves. The other nice thing is it does, some people have a question, is it a real psychedelic? And anyone who's done ketamine in a proper way with the proper setting, an eye mask and earphones, I'll go into that in a second, it does induce a very significant psychedelic experience, but you don't hallucinate in the typical sense. So, when you're wearing an eye mask and earphones, you will see the musical in it's called synesthesia, where you'll actually see the music in a certain way. But if you take off the eye mask and earphones, there's no visions. It doesn't distort your reality in any way. You'll be, your depth perception, your coordination will be off, but you don't, you won't see things like you might on LSD or some other psychedelics or mushroom, psilocybin. So from that perspective, it's very interesting and safe. A psychedelic agent. It's short acting. So the nice thing about ketamine is it lasts for, our drip goes over 60 minutes. Some other psychedelics, it's a journey. It's usually taken orally, and it could last for up to 5-6 hours. LSD up to 14 hours. So it's safe and it's easy to use. And our outcomes, I think, could be just as good, if not better. Some people might argue with that, but I think when used properly with proper preparation and integration and music and the eye mask, the whole setting, we're finding it incredibly effective as an agent to treat, treatment-resistant mood disorders. So, do you want me to go into the protocol and how it works? Like how,
Yes, please. Yeah, that would be
and-
so amazing.
yeah. So, usually when people are, before they even see me, they'll come in, they'll have an initial screening with we have a team of people here who, people who call in. They're either referred by their mental health providers or they find us online. And most of the people coming in have been through years of different types of treatment, whether it's psychiatric medications, therapy, addiction care, and they've sort of reached a wall. Like nothing's really working. They're not tolerating the side effects of some of these things. So they find us. So they would screen them, make sure that there's no contraindications, no issues that could prevent them. And some of the contraindications, some of the issues that prevent people from getting treatment would be psychosis. So if anyone's ever had a history of psychosis or schizophrenia, this could induce, any psychedelic agent could trigger a like an acute psychosis. So we avoid treating those people with a history of psychosis. Okay. And even if some people have a close family history of schizophrenia, we might not take those cases. People with active mania, so bipolar disease, and they're in an active manic state, that ketamine and other psychedelic agents can trigger a manic episode. So depending on, and there are some cases where we'll work with psychiatrists if people are in a very depressive stage of their bipolar disease. Sometimes we might use some ketamine to get them out, and with some help and some medical medicine, we can actually prevent them from going into a manic state. But that's a case-by-case basis. So those are some two things. And then people with very, significant heart issues, people with uncontrolled thyroid disease, unstable medical conditions, we might prevent them from going through the treatment. So once they're cleared, and we determine that they have a good indication for a reason to come in for treatment, then they'll see myself or a nurse practitioner, and we do a full medical and psychiatric evaluation, which is about an hour, where we go through their medical history, psychiatric history, make sure it's a safe option for them, a good option for them. We go through the whole protocol, explain to them what this is about, and then we, answer any questions. Once they're cleared for treatment, they will come in. And our protocol is a series of 2 infusions a week over a 3-week period, so 6 infusions over a 3-week period. Sometimes we might modify that and space it out a little bit more depending on their situation. So once that's set, they come in, they have a nursing assessment. We have an RN, a nurse that checks their blood pressure, make sure that they're everything's stable. Then they meet with, then they'll have an IV placed, and then they meet with the practitioner, myself, or we have a nurse practitioner, and we always discuss the dose. We actually ask for permission to give the medicine to them. And then we discuss the dose each time. And we usually, our dose ranges, we range anywhere from, we dose by weight, 0.8 milligrams per kilogram, all the way to 2 and above, depending on what people need and how they respond to the experience. And then each time they come in, we have a discussion based on how they responded to the previous experience, how they're feeling since the last experience. Then we will decide on the dose. I tend to go up a little bit each time by, maybe by 0.2 milligrams per kilogram, up until a point where they say, hey, that last one was enough. I'm okay here. And they reach a plateau. And that's really a discussion we have, with the member, the person coming in. So once we determine the dose, they put it in the bag, and then they meet with an integration coach. And an integration coach is someone, it's not therapy. Although some of our integration coaches are therapists, they can be life coaches who come in just to create a safe space, set people's intentions, what they want to get out of this experience, so they feel like they're part of the experience and part of the situation. And then they do some breath work. They put on the mask, earphones, and then they go into the journey afterwards. So we create it's very important to create a safe space, set and setting. So the mindset, what you come in with, what you want to get out of it, and then the setting, the actual environment. You want to feel like you're in a safe place, and we put a lot of work into our setting up a center where it doesn't feel very clinical. It feels very nourishing, as much as it can in Midtown Manhattan, 53rd and Madison. We try and create a safe space, and so people feel comfortable to let go into the experience. And then, so hopefully, they have a 60-minute session. And then after the session is over, takes about another half hour to come out of it. Then they meet with the integration coach again to set, sort of make sense of what comes up out of the journey, to integrate some of the ideas into their experience if they're ready to do so afterwards. Sometimes they might need a few days to process. And then they meet with the nurse again, checks their vital signs and make sure everything's stable. And then once they're stable to go, they're released. And that's what we do. Yeah.
Sounds very clinical and safe.
Yeah, it's very safe. That's the most important thing. I mean, in order to like psychedelics is not, it works. It's a clinical, but it's also psychedelic, and it works in a way that we don't all understand completely, but and what people experience is very otherworldly, and that's very important. It allows us to see our own existence and the world in a new way, in a more open way, and hopefully reframe some of the traumas. And a good 90 or so % of the people who come in here have had difficult life situations that haven't been properly processed. Some people call it trauma, and so how do we move forward and be able to see the world not through the eyes of that traumatized child, but through our current situation, which we're safe now, and to be able to reframe our situation, to be able to choose how we want to respond to things in our life, through our current situation, not that was imposed on us through certain traumatic situations in our life. So
that's so wonderful. Thank you for speaking to that as well. We have a returning guest. She's currently gone through a ketamine assisted therapy training, and she had to obviously experience it herself. And what she shared with us was through her other experiences with different medicines, she felt like there was something holding, there was some higher power, something, a sense of protection. But she said with ketamine, it felt like I needed to step in and be that agent, have that agency, and really build on that courage and really face it. And she found that very empowering.
Right. Yeah.
Yeah.
I agree. I mean, I think that's the beautiful. We're sort of finding the therapist within ourselves, the power within ourselves. And I always try and reassure our members here is that like the ketamine is not the medicine. The ketamine is just a tool. It's like almost like I see it as a chemical key to our ego, to this processing center that's here to help make sure that we exist in this world, and all it is, it's lowering the intensity of this processing center, and it gives us. And when you start to take this offline, we get more access to this deeper sense of self, this inner. Some people call it a soul. Some people call it an inner voice, intuitive self, whatever people feel comfortable calling it. But that's really the medicine. And sometimes that gets drowned out, and that's light. That's like, no child in this world is ever born. They're not born into this world depressed. That happens usually, with experience life and different life experiences that sort of impose on that. But kids are generally happy, and that's our default, and that's our essence, that beautiful essence. So we want to get back into that essence that that has a desire to live, to have meaning and purpose and joy and happiness. That's who we are. But the brain is here to make sure that we exist. So we have these two forces that have nothing to do with each other, trying to coexist, and we're trying to find a better balance. We're not trying to get rid of the ego. We're not trying to destroy it or kill it. We just want to have a better relationship with it. And hopefully these two, so the ego is here to protect us, but we also need to live. So we want to have, it's a sort of recalibration process. And that's how I see this. So I think the medicine is really the true medicine, that desire to live, and that desire to balance is within us. That's always there. It's always been there. It was there before you came in, and before we were in this world, and it's here now, and it always will be here. We just don't see it because we don't feel safe. So the ketamine allows us to get a glimpse, a little glimpse of that safety, of that who we are at our essence, and that's the empowering part of it. And hopefully when this comes back online, at least we've experienced it, so the two can actually start to work a little bit in better harmony, I guess. Yeah.
Yeah. No, that's wonderful. I like the analogy of that. We have this concept that we talk about infantile states, through the trauma experiences or responses or stuck trauma, whatever that we carry. Do you also feel like people are stuck? Because I think you mentioned something, I don't know how you worded it, but it almost feels like grown-ups experiencing the world through an infantile perspective. Right. So you are helping them kind of transition from that to a more adult, mature, creative person.
Yeah, or I'm not sure. I think actually it's the opposite. I think that some of what's imposed, I think the infantile state's happy and joyful and curious and wondrous. And, kids will, they get hurt, they cry, and then 5 minutes later, they're laughing and playing again. Like, that's where we want to get to. That being less reactive, not putting so much unnecessary meaning. Adults live in a very unsafe world. We live with a lot of fear that was imposed on us from media, from our parents, from different traumatic situations, that we lose that creativity, that ability to just be spontaneous. And that's the heaviness, and that the desire, that not feeling safe, I need to survive. So we want to go back to that infantile, that essence of who we are. And it's funny because, when they give children the psychedelic, the ketamine in the emergency room, kids have a much easier time, and they give it very high doses, crazy egolytic doses. And the kids don't freak out most of the time. They don't. They're thinking, they're infantile. They're curious. They're like, oh, this is cool. Like, they think they have imaginary friends. Like, they see the world in a much more fluid state. Adults, you give them this and they freak out. They see something that scares them, they can't handle it, and they panic and they rip off they start to have a problem because they don't want to let go. They don't feel safe. So it's the opposite. We want to get away from that programming that went into it, often imposed by adults, scared adults who have been imposing their fearfulness, their small-mindedness on innocent children in ways. And it's part of the process. It's not good or bad. I'm not I'm not saying it's bad, but we want to find a better balance with it. Obviously, we can't live like children. We have to, certain things in this life that we have to experience, and there has to be this level of maturity and adulthood to deal with them. So we can't be acting like children all the time, but it's nice to go back there once in a while and remember that's who we are.
Yeah, absolutely. Is it true that you administered thousands of these IV sessions?
Yeah, I think we've had close to 1,500 people come through our program, and well over 7,000 of these. I think I haven't counted recently, but I know before, the last time I checked months ago, it was around over 6,000. So it's been a lot. So we have a lot of experience. Doesn't mean I'm still humbled each time I do it. It's a different, like, I walk into the room and you don't know what you're going to be. So, I don't feel like I'm more of a professional than anyone else. I don't think I'm better than I think the most key thing to becoming a good integration coach or a good provider in this field is to be humble to it, just to be open. And every time you go in the room, it's a new person, and every experience is new. And that's something that came up. We do encourage, all of our people to do this work. I think you have to have done it. If you're going to administer this to people, you better have done it. I don't want to force anyone to do it, but because it's very humbling. And so it helps me a lot explain I know what people are going through. So when I'm dosing people, I'm careful. Like when I went through, I'm like, whoa, it was a lot. And I know what they're going through. So, and it also helps me be humble walking in the room. So that's my recommendation is this. So as much as I've seen 6,000 of these, it's still, every one of them is unique. Every one of them is unique. So, but the one thing we do have experience is holding space and being able to reframe it. So people say, could you have a bad trip? And I don't believe in bad trips. I don't think anyone goes anywhere they're not meant to go for the most part. I think if you're well supported and you create a safe environment, that even a difficult experience on psychedelics can be extremely beneficial, could be and therapeutic. And that's what we've seen here,
Yeah.
Yeah.
Why do you think that mainstream out there, everybody's talking about bad trips? Where did that come about? Do you have any?
I know where they come about. I think people are doing, psychedelics with their friends or their high school friends or their, and someone, you have 5 people or a bunch of people doing psychedelics at a concert or something, and someone starts to, have a difficult experience. Someone triggers them in some way, and then it deregulates everybody else in the group because there's no one there to support you. But if you're in a clinical setting, in a safe environment, in nature, or you're in a clinical situation here, doing ayahuasca, and you have people who are really experienced, who are not on the drug, first of all, so can hold space for you if you are having a difficult experience, do some breath work, ease them, reassure them, and they go right back in it. And I've seen it that's where I do have the experience, is we've had people have very difficult experiences many times, and we've been able to really bring it down, help them re-regulate and get right back into the experience. I rarely have to turn it off, rarely. I might lower the drip a little bit. Then we go in, we look in the eyes if they press, and then I look at, and I really help them. We do some breath work, and then we smile like with a nice comment, and then we just bring them back. And then afterwards, we help them integrate the difficult experience. And often the difficult experience, there's meaning in there. And if you can, it's like a bad dream. I mean, every time we go and people, we have psychedelic experiences every time we go to sleep. I mean, if you think about dreaming, it's a little crazy. And you could have a very bad dream. What's a bad dream? It's a bad trip. What is it? But it's very important. I learned this in my spiritual studies, but how you interpret the dream is very important. And it's always good to see there's always goodness in the dream. There's always something good to be learned from the dream. Always, 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 even the worst dream. That and the person interpreting it, if you can try and extract the good, the lesson out of it, then you turn that bad dream or that bad trip into a good trip. And that's what I think. Again, I don't know how spiritual your audience is or any of that, but I do believe that there's something more to us than what we see in the mirror, the physicality, and anyone who's done this work will probably agree with me. But in this essence of that inner self, that inner voice, that soul, I think is what's driving the whole journey. And again, I say it always, always, always. You don't go anywhere you're not meant to go. As long as you're in the right setting and properly supported, it can be very helpful. So
that's amazing. Thank you for reinforcing that. I think this is sort of what we talk a lot about on this channel as well. Also, the mystical experiences. You talk about the intersection of neuroscience, mystical experience, integration therapy, all of it. We need all of it, and to really address the underlying issues. And do you also believe, because we need all these modalities or intersections of all of these amazing modalities, because the people who seek this kind of medicine, they are having a hard life, they are having difficult time processing and being in the world, right? So I believe, if you could just explain what you mean by that statement as well.
Is of what of the mystical experience?
Yeah, like we need we need all of this together.
Yeah, I think, as far as when you're talking about a psychedelic experience, the ketamine or the psilocybin or the LSD or the ayahuasca or the San Pedro or the whatever it is, these are all just different keys, the different tools, but it's only one part. I don't think that we shouldn't put too much emphasis on the substance. It's more about also yourself and what you're bringing into it. The environment is extremely, the setting we always talk about, like the environment, the safe space, the people who are there to help support you through the experience is immensely important. It's vital. And it's just as much the music. The music is just as important as the ketamine. I said over again, if someone's going, it has a significant effect on what people experience and what they get out of it. So there's a lot of intentionality in the music. Like people ask, oh, could I bring my own music? No. There's times where people have a lot of psychedelic experience and they might have playlists we might let, but generally, you're not going to listen to, AC/DC and come in and have the same experience. It just doesn't work. It doesn't work that way. So I think that it's, when you look at when you take psychedelic treatment or this modality, you have to look at it as a whole, as a package deal. It's not just a substance. People can take, go in at home in the backyard or go to a party and draw in and take some LSD, and you can have a good time. I'm not saying, I'm not pushing, people want to do that. I have no problem, that's their choice, but it's going to be a very different, it's not going to be the same type of experience generally. Yeah.
Yeah. No, this is a great call as well. That's wonderful.
Responsible. These things, one thing I'm in awe of, and doing the ketamine myself, like when I walked out of there, this is a big deal. When you take these substances and you're taking down your defense mechanisms, you're turning off this ego, this brain, and getting access to a very deep side of it. What you experience on the other side of it is very significant, and you have to be very careful, what you're going to uncover. And you're in the proper space to do that, because it's otherworldly, and not everyone's ready to see it. Not everyone has to see it, and it's not for everybody. Also, you have to have a desire. I think these medicines should call you sometimes. I think they become very trendy. Everyone wants to do ayahuasca. It's very trendy to do ayahuasca, but you have to know what you're getting yourself into when you're going to do these things, and where you're doing it, who you're doing it with, who the shamans are. You have to be in a safe space. So when you go into these other states, it's a big responsibility, and it's work. So
yeah. So here's a controversial question.
yeah.
Do you also agree, because this is like the conversations and discussions I'm hearing and observing. So do you also believe that maybe ketamine, MDMA, and LSD should be part of the social integrated substance for the Western mind?
You mean using it as needed, like having and
Clinical,
legalizing it,
exactly.
or
Yeah.
legalizing it so it can be bought on the street? No, I don't. Like I definitely not ketamine, because I think it does have some risks. There are some, and ketamine, again, used in lower doses on a regular basis, can be addictive. You know, yeah, I think you lose the touch. I think it can turn, if it gets abused and used in an inappropriate way, it can also be, I don't want to get dangerous, because I can have fun with LSD. I'm not saying people shouldn't do it. And some people are responsible and have fun with it. Like even mushrooms, I think, they can be in smaller doses, especially, like, be very, it can be fun. I mean, I think alcohol's a lot worse out of all of them. If I had to legalize one, make one of them illegal, I would make alcohol illegal out of all of them. So I would choose that. If I choose to make one. So we already have one substance out there that's misused and highly and very dangerous and causes more deaths than any other drug out there, is alcohol. That being said, when you use it in moderation, have a nice glass of wine and a buzz, it could be okay. It could be nice, Same thing with those substances. So it's a tough one. Yeah, I don't know. I think MDMA could have dangers overall. I don't have a big problem with it. Ketamine, different. I don't think it's best to make that legal. And psilocybin also, I don't have a big problem with that, making that legal. Again, people should be educated. If we're going to make these things legal, the government and whoever it is should really do a lot of psychoeducation and be able to use it. I don't think there's an addictive problem with it. Like opiates kill people, mushrooms, no one's dying from mushrooms, LSD, generally. MDMA can be dangerous, actually. It's an amphetamine and can cause death in certain people with arrhythmias and things like that. So MDMA, you do have to be careful with it. It's not so benign. I think mushrooms and LSD are definitely safer,
Yeah. Thank you for this. Really appreciate that.
And
so coming back to Nushama, your center, what are the things that you're offering? You talked about the program. So can people come into a program? What are the things that you are leading and offering right now?
So right now we have two main protocols. Like one is for treatment-resistant mood disorders. So, depression, severe multi-drug resistant depression, PTSD, anxiety. I mean, all these things are the same, right? So they're different symptom complexes, but it's not like separate disease entities. So, but we do treat, these are the symptoms we treat, mostly anxiety, PTSD, depression, a little bit of OCD, difficult, times to treat that, eating disorders. So especially binge purge, we've had really, really good results with people who have a bulimic eating disorder, especially. And then we have a separate protocol for addiction, alcohol use disorders. It was developed, we're using a protocol that was developed in the UK at Exeter University through the Awaken Health Centers. And so we've teamed up with them to offer their program. And that's been great. And, so that's specifically a little bit more psychotherapy and mixed in with ketamine infusions as well, in a different type of protocol. So those are really, those are our main indications for treatment at this point.
Wonderful. Wonderful. Yes, I'm aware of the Awaken clinics in the UK as well. They're doing great work here. And in one of your conversations, I heard you say something very powerful, and I think we need to maybe emphasize more on this. You said in the settings, when you are administering the ketamine infusion, you talk about being more and saying less, being more, kind of like it's really the counter. People in therapy, it's almost like as a facilitator, they tend to talk, they tend to want to guide, they tend to want to point out and help unpack and things like that. That was really powerful. We don't talk about that enough. So that was really wonderful what you said there. So being more, what does that look like in that setting?
Yeah, I think, listen, I think that there's a process. I think if you have to sum up psychedelic work, it's all about letting go. The process of really letting go, and letting go isn't forgetting. It's about actually learning from our past, extreme and accepting our past, forgiving our past, forgiving ourselves, and then finding the wisdom and the strength through all of our past life experiences. So when I say that letting, part of that process of letting go is, number one, to acknowledge what I have to let go of, and that's where I think therapy, some therapy really helps us unpack some of that stuff, and just to become more, bring it to our awareness, what needs to be brought into our awareness. But, sometimes that can go on too long, and someone in 10 years of therapy, I mean, what are you going to say more? It's like, at some point we have to go to the next stage, and that's acceptance. And that's where the being comes in, just to be with it, to feel it. This situation hurt me, to acknowledge it and to move through it, so, and then to know and accept that with it, that situation, whatever it was that hurt me, it wasn't there. That wasn't its purpose to hurt us. There is an opportunity to grow, to have some wisdom. In a spiritual lecture I listened to, they said that wisdom is a memory without the emotion. And I love that. It just really it keeps on resonating with me. Is that the past event, the only reason you have an emotion attached to a past memory event is it hasn't been processed. We haven't let go of it, and once we accept that whatever happened, and most of the people that hurt us were hurt themselves. So it's a process, we're here to learn to accept and to try and extract. If it happened, it happened. We can't take it back, but at least we can grow from it, become more wise from it. And then once we accept that, then to forgive, there's other chains of to forgive those who brought us this life lesson. And that's hard. And forgiveness is not justifying what anyone did to us. There's no justification. I don't care if your parent was beaten themselves, doesn't just justify them beating their child, that there's no excuse for it, but they did, and so how could we forgive them, to find compassion for them, to release the chains that we have to that situation, that person that brought that situation, and let go. So again, the universe will take care of them. And anyone who hurts anybody else, there is, and that there might be consequences, not punishments, but just life lessons to help them grow and evolve away from it. So that's their process. But what we have to focus on is our own. And so part of what the psychedelics do help us do is to step outside, to be able to see all this, to be with those situations, to see that there's another way of looking at these situations, and then just to let them pass like a cloud, let them pass. And that opens them up. So then the next time we're triggered, we see it, we can choose how we want to see that situation. And it can be very, beautiful. And there is a neuroplastic, and there's a neurophysiologic mechanism for this, but there's also other things we don't understand about how this happens. I think there's different levels. There's the physical level, and then there's the super physical, the mystical level, which I think is a science. And when we talk about mystical experiences and spirituality, I think mysticism and spirituality, I think it's a science that we just don't know yet. We're not that smart. We think we're so smart. There's a lot we don't know about the universe and the energies and everything that exists around us that we don't have privy to. Doesn't mean we can't benefit from it or can't access it without understanding it fully. And that's okay. That's okay. So,
yeah, absolutely.
I hope that answers your question in a very roundabout way.
Yes, you did. And this has been so wonderfully informative. Thank you so much for sharing your wisdom. As we're coming to the end of our conversation, where can our listeners find you? Are you active on social media? Where can they follow you?
Yeah, I mean, I don't personally use social media, but we are active through Nushama. If you go to nushama.com, or look up, I think it's Nushama Wellness, the Instagram, they have feeds, so through nushama.com, you can find a lot of information, and then click on there, you'll find our Instagram feed. So we are active there to some extent. And so I'm trying to do podcasts and educate. I think this is a new field. I think it's the future. I really do. I think, and we're here to sort of figure out the best way to integrate this beautiful work, and make it the most effective, and learn from mistakes. We have to be humble also. That's if I have one piece of advice to everyone in this field. I don't care how academic we may be, or, never think you know it all. We really always have to be humble, and we're all doing the best we can to figure out how best to treat people with this work. And so.
That's so wonderful. And I love your approach. Thank you so much. Bringing in some spirituality and some mysticism into it really does give that depth and more, it makes it more interesting. And I think it makes
It's
it
fun. It's
yeah.
more fun and meaningful. I think we need more meaning. You know, I think having meaning in our life situations, I think the biggest problem that people have is they become a victim. We become, we lose the sense of meaning, even in our difficulties. And when there's this, I don't know if anyone ever read Viktor Frankl's, Man's Search for Meaning. It's a beautiful book, but it goes over that, people in very difficult situations. If you find meaning, you can make it through anything. And I think that's some of what we're trying to work on with this type of work is that pursuit.
Yeah. No, this is great. Yes, I feel like the medicines are coming to teach us again to reconnect for whatever that is.
Yes.
Yeah.
Yeah. It's not by chance that they're coming here now. So the key is to use them responsibly so they don't get cut off again. That's our challenge.
Yeah, absolutely. As last words of wisdom, what would you like to say to our listeners? Any advice, anything that you'd like to end the conversation with?
Hope. I think that there's hope out there. I don't see mental health issues. I don't think depression, anxiety, PTSD are physical genetic issues. They've never found a gene for these things. So anyone who's suffering deeply with these things, to know that there is a way out, and that's not through suicide or ending your life. You can actually live a fulfilled and meaningful life. And to don't give up, don't give up. These things are coming, and they're going to be more accessible, hopefully more accessible to more people and cost less, hopefully over time. The insurance will eventually start to cover it, or government programs will cover it. So there is hope out there, and to really, if this is something that really calls that you're called to find places that you align with, and to look into this work, read up about it, know what you're getting yourself into, of course. But to know that you're not sick and don't give up hope, that you're not here in this world. We're not here to suffer or to be punished. I don't care what you did or what you were exposed to. There's hope, and that's what I would like to leave people with.
Amazing, beautiful. Thank you so much.
Mm-hmm.
Thanks again, and hope to have you maybe back very soon. Follow your journey, and hope to speak to you again soon.
If you're ever in New York, feel free to come by, and if anyone's in New York, you can come visit us at Nushama. It's spelled a little weird, NUSHAMA.com, but it's an interesting name.
Yeah, we have also US listeners, and I'm sure they'll appreciate this conversation. Thank you again. Thank you everyone for joining this conversation. Hope you guys enjoyed. Please get in touch. We'll have all the links and the information for Dr. Steven Radowitz for you. And I'll see you on the next one. Bye for now. Thank you.
Thank you for having me.
Thank you so much for joining us. Psychedelic Conversations podcast is designed to educate, inform, and expand awareness. For more information, please head over to psychedelicconversations.com. You can also share with your friends or leave a review so that we can reach more people. You can also join us in our private Facebook group to keep the conversation going. This show is for information purposes only, and it is not intended to provide mental health or medical advice. Thanks for listening.